What are the elements of a successful collaboration with startups? How do you make sure that both sides understand each other? That's very difficult. We have 2 talks on the subject. Then we'll have a Q&A session with the same experts, and you all will have a chance to ask them anything you like to know. But first, let's welcome Virve Ilkka from HealthSPA. Welcome. HealthSPA is a non-profit association for health startups with a bold goal to put Finland on the world map when it comes to health. Virve is here to give us the startup perspective on collaborating with the public sector. Here you go, Virve.
Thank you, Papa. Good afternoon, everyone. Wonderful to see so many of you here today. You basically stole my introduction, but we do our day-to-day job to bring the startup voice and innovation visible and to help the right connections between the extended stakeholders. And for us to be able to do our job well, we've been conducting a survey this fall, interviewing or approaching 370 health startups, and with our 18% response rate, we are still analyzing our results, but I wanted to share 3 teasers of our survey with you all here today. The first one is the good news that Finland is a great country to start up a startup. Hats off for you, you know the part that you played. Thank you for that, good job, well done. But that's the basis. The second takeaway is related to this slide behind me. In celebration for the metro line extended here in Helsinki, we have been mapping a metro map slightly more complex of our own, that of the Finnish health ecosystem. Even though the ecosystem is seen as a supportive and a good player, it is still a bit blurry, a bit overwhelming for many startups. What role does everyone play in this? And come to think about it, when we all learned the term ecosystem in schools, it was often illustrated with an image of a jungle. And let's admit it, it's a bit of a jungle still out there to which we all can bring and should be bringing clarity to by working closer together, having a dialogue. So if you want to make sure you are at the right place on this map, have the dialogue with us on our booth here still today. My final takeaway from our survey is also related to the slide behind me. Why on earth am I sharing a draft with you? An unfinished work, and let's admit it, it's a bit ugly still. Well, the message from the startups is that's exactly what all of us should be doing. Sharing our drafts, sharing our thought processes, sharing our ideas, even if they are still subject to change, even if there are bound to be some alterations in the road, and while on it, listening to those of the others as well. And if we think about it, the era of having one idea, then working and planning to go towards that and then achieving your original idea is really not the reality if it ever was. And if we carry on just working on our own silos, the slow purchasing and decision-making processes will only ever result outdated results. So let's have the dialogue, let's have the unfinished work in front of one another, and let's see what a lot more interesting future we have together when we are not working to the pre-designated end result, but a very fruitful and interesting journey of constant improvement. So let me conclude the will to be cooperating. The good basis is here, and I want to congratulate everyone in this room for being a living testimony on that. But we have to carry on working together and not just have this one event here at Slush, but to continue to earn those internationally recognized references that we also desperately desire. So let me invite you, as the slush melts away and sun shines again, to Upgraded Life Festival, which is the biggest startup-hosted event in the Nordics in the subject of health, held in here in Helsinki at the Meilahti hospital area. See you there, and let's carry on working together. Thank you.
Thank you, Virve. And we will come back to you after a while with questions from the audience. And I noticed that the word cooperation is the word of today, the theme of today, the theme of Slush. So keep that in mind, cooperation. Next, we will have a real-life case example of how a city has worked together with a startup. Let's welcome Petteri Hirvonen from Klinik and Rauni Kudia from the city of Vantaa. Welcome.
Okay, hello everybody. Thank you for the invite. It's a pleasure to get to talk to you in between the Slush rush, as you could call. So I'm Petteri Hirvonen, and I'm happy to have Rauni Kudia from Vantaa with me. So I'm about to share a little story about startups, our startup collaborating with the big city of Vantaa, and what we learned on the way, and hope to hear from Rauni what they learned. I don't know if it's the thing. Okay, well, do I have a clicker actually here? Because I have the slides.
Yes,
Okay, next slide, please. Yes, so about Klinik, it's not news that, well, we are living in a digital era. And but the point is that, well, the people of all ages are ready to use digital services, but they have to be easy to use and intuitive. So that's our mission. Next slide. And so what we are addressing is the painful way of people currently access healthcare. The normal way is to contact the healthcare center via phone or to walk onto the centers. It takes often minutes or hours to wait in the phone lines, and the nurse asks you questions. And they might tell you, okay, come on over, we take a look at you, and the next doctor asks the same questions. And also the next professional might ask the same questions all over again. And the phone work, it's controlling the time of the professionals today. And also, it's not good for the common people. It doesn't raise a trust to the healthcare system that it's so easy, it's so hard to get in touch with the professionals. Next slide. So what we do, we bring our AI-based tools to replace the first line of contact, so that the common people can start the journey to the healthcare whenever they need, whenever they want, and whenever they have time. And this frees up the nurses from the hard phone work to do more of the things that they were trained to do and to meet the right people at the right time. So we're using the AI to direct the people more straightforward to the right point of care, to meet the right professional at the right time. And this is what Vantaa was interested in when we first met. Next slide. Okay, well, you know, I probably don't have to mention to startups that it might be, when dealing with the big city, it might be a bit slower than your average workday to making decisions, chasing the directions and stuff like that. And here's the timeline of us collaborating with Vantaa. So we first met them in the beginning of 2016, and a working committee was formed at May 2016, and then things started to happen. Okay, it might seem like a long road, about 5 years to be in production, but I was surprised in the way that, well, all the time there was things happening, and Vantaa made us do things according to their plans and their routines, and that's really a good thing, because we didn't miss a thing. When we were ready to go to production, we knew that, okay, we're good to go, we're safe. So now we launch first at healthcare sector, at Myyrmäki region, and then later the dental care, and now occupational healthcare as well. It's still a piloting deal, we don't know how it goes on, but we're happy to be going all the way up. And next slide. And so, just some data that we are also providing to Vantaa. The work that we have done with the ease of use of the tools has paid out. Users from all age groups are using the service. And the things that we have addressed to help Vantaa to do is that we have been able to widen the access to healthcare, so people can make the contact even during the weekends. And it's been actually, now we know that there's been a hiding need for people to contact healthcare, not during the work hours, but before and after the work hours. And now they have a channel to do that. So as early as 3 in the morning, people start using the channel, the AI-based channel, and the high peak actually for the days at between 6 and 7. So this is something that we take away from the morning rush hour from the phone call lines, and also helping people to get contact when they have the need. So they don't have to wait for the phone calls during the night, during the workday. Imagine trying to address that with a chat, live chat. It's not possible. Okay, next slide.
Okay, I come from city of Vantaa and ICT department, so I'm not a healthcare professional. And this was very, very interesting project. And we were thinking with Petteri, what can we do in the project to speed up the calling process or processing the patients into a treatment. So we made this picture. So economy of waiting, the shorter it is, more effective it should be. So if you plan and plan and plan, finally you break. I mean, you are using your brakes. You don't break down, but you use your brakes. That means that if you plan too strict, too deep, too long time, and you want everything to be ready beforehand, you are making a purchase. That means that it takes a year or 2 years or even 5 years, or it never goes to a goal. So what we end up to do is to try and learn. So fast decision making, and then you start doing, and you learn on the way. So you can 50% or even more. The time is shorter when you develop the service. Next slide, please. Kumpi? Yeah. Okay. For my part, what I consider is that the public organization should be brave. You should have courage enough to get what you are dreaming of, not to give up. And you have to know your game. So if your target is clear, then you just have the startup to do your thing. You always find a way if you want to, if you really want to, and move to action. Next slide.
Okay, then for the startups to collaborate with the public sector, I think it starts with the same thing. Be brave. Don't be afraid of probably the size of the organizations or the seeming slowness or something like that. They are not slow. I think it's good that you can provide the enthusiastic way of, making the plans. You have found something. You have a solution to a problem that they also have. So just be brave and to talk to them, and make mutual plans together in the beginning. And there's also, as I told you, there's a lot to be learned from the public sector and the bigger organizations in a way that, well, you have told that there's a problem you are addressing, but be careful to listen to that, well, okay, they might have it a little bit different than you have taught. So, and be ready to adapt and listen. And then, of course, be patient. It takes time. The problem that you're addressing your company, it has taken time. So now they are meeting you the first time. So it's about to be not the days, not maybe probably weeks, maybe months that you go on. But being patient, it pays out.
Yeah. Being patient to get agreement, but when you get started, it's faster than you think.
Sounds great.
Yes.
Thank you, Petteri and Rauni.
Thank you very much.
And now I would like to ask Virve Ilkka from HealthSPA back up on the stage. Now over to you, the wonderful audience. What would you like to ask our experts about how startups and the public sector can collaborate successfully? It would be very nice if you could tell us who you are and where you are from before asking. And feel free to ask whatever you are thinking about. Who want to go first? Just raise your hand. And if you want to use the SMS, then the number is 12154. So, who want to go first? There we have one asker.
Yes.
Go ahead.
Mikael Rinnetmäki
You're
from
welcome.
SensorTrend. So you said that you're currently in a pilot phase. You have a piloting agreement. Do you have anything set up for after that? So what happens after the pilot finishes? Have you outlined any negotiations for that?
Well, we do have some plans and discussions going on, but it depends on the data and the results that we get also. If Vantaa is happy with the thing and also we're happy with the thing, so then I think there's a good chance to get a more longer deal. But the thing is that, well, we actually, honestly, I'm not 100% sure that there's anything to that. So but we just want to do it because it's been a fruitful collaboration.
Thank you. When you are figuring out what to ask, I start by asking a couple of questions myself about the nature of the collaboration. What has been the greatest thing you have learned through this collaboration? Maybe Rauni will start.
Okay. Healthcare section, the people in the project, they were so enthusiastic about this. There's no limits. But you have to know how to sell. If you don't know how to sell it, and I don't mean that I'm a salesman or a woman, I'm not. I'm an IT pro, but you have to know how to sell the idea. That's the key. If it's not good enough, nobody's going to buy. You know that. You are business makers, right?
Can you define who is a good seller? What does he or her doing?
Well, good salesman is a person who knows the subject.
Yeah.
And your product is suitable for the cause or the use. That's all. Petteri can combine me.
Well, sales is another thing. I'm a doctor actually by profession, but at least I succeeded with one deal. So but I don't know really.
What have you learned through collaboration, Virve?
I have learned a lot of positive things because this room is full of higher professionalism that I could ever even dream of. And the fact that the mindset is already there is incredible. But at the same time, I have to say that it's a bit of a happy chance if you meet the right people. It's not necessarily institutionalized yet. And even though we have all good examples, we have also the negative ones, because it might be that you just knocked the wrong door, the one opening that didn't know to whom to guide you to. So we are not yet on the same page, even though our mindsets are already shared.
Rauni.
I continue from that. If you don't have the right door, the person behind the door who is closing it should think otherwise, that you should say maybe, not always no. That's what I do. That's my daily job.
Yeah, that's true. And it's important to remember that no isn't always no. Yeah, but now, any questions from the audience? Here we go.
So again, Mikael Rintmäki from Sensotrend. So how do you sell to IT people? We've heard of many startups going to healthcare professionals first, and the healthcare professionals are really enthusiastic. And yeah, we want to take it into use, in daily use. And then you get approached by IT professionals who basically say no. So how can you actually sell this stuff to them?
Maybe I'm an exception on that, because I always say maybe. I want to see, but maybe there's sometimes a door I say no. I'm not a person to decide of purchasing anything, but I can suggest it that we should get this one. The better your technology is and your patient data is secure, the better it is. That's all I can say.
Yeah, about the selling thing, one thing came to my mind, and also as a reply to this question. So I think the most important thing in selling or collaboration, it's the listening. Listen each other and figure out how to make the things happen that you both want to. That's the most important thing in selling and also otherwise.
Virve.
Yeah, the empathy, really, I'm a big supporter of that. And meaning that, understanding that the startups have a different time span with which they operate. And even though it's sometimes annoying the impatience that the startups present, we have to remember that they might not be there anymore 4 months later when you are ready to say your strong maybe. So the empathy to understand and hear not just the words, but the place and the context from where the other one comes from. And the same goes the other way around. Understand that there are stronger hierarchical systems that don't just change overnight, even though we are trying to do the changing today.
So we are talking about the collaboration between public sector and startups. More questions from the audience. Here we have one. Go ahead.
Yes, so my name is Mats Melén, and I work for a company called Virve. So many times, I'm a sales guy, by the way, so many times I've been contacting these public sectors and cities. And one of the challenges from a startup point of view is the budget. Now, you come with a fantastic idea, a fantastic product, at least you think so. Often it is a fantastic product. I promise you.
It is, of course.
But how do you get the budget to this? Because it can be so new, right? So nobody has ever budgeted anything, or there's no money for this. So where do you find the budget?
Okay. Our CIO just invented this year a new concept of buying is a French deal. So you have the steady money and what you can give on that money. I think that's a pretty good idea because the procurement law is quite strict, but it's only a frame. We all know in Finland that the law is very strict, but inside the law, how do you purchase? What do you have? What you want to have? You can be very agile on that. You don't have to stick on this same old pattern and process and thinking. French buying is a good one.
I like that. Thank you.
French buying, good. We have time for one more question from the audience who want to pick the opportunity. Just raise your hand. I mean, there we have one. Congratulations. You brave person.
Thank you.
Who are you?
Hi, my name's Katrina. I'm with Brain Care. I'm the CEO. I'm another startup company. And my question is, if the city or the community itself finds economic benefit in what the startup's doing, do you plan on making any white papers to show that there's actually economic benefits so that co-startups could actually reference such a white paper to prove that to hospitals, look, there are savings being made and doing such a digitalization will make benefits for everyone in the community?
Well, in city of Vantaa, we always plan and we always count. So it's how the investment is paying back is in social welfare area, healthcare area. Now, you know, the apotti is here also, it's coming, so it's giving restrictions, but we have a system of 4 years payback. So it's kind of a, you know, besides the law. That's our system. But we count. White papers are good, but we don't use those at the moment, so it's a good tip. Thanks.
Thank you.
Thank you. Thank you, Rauni. Thank you, Petteri. And thank you, Virve. Thank you for a lively and informative discussion. Let's give a round of applause to our experts.